paraphilia is an atypical source of sexual attraction, arousal, or gratification. Some of the most common paraphilias include frauderism, arousal from rubbing up against a non-consenting adult.
Oh my gosh.
Sadism and masochism involve the infliction and receiving of pain from consenting adults. Sadism is receiving pleasure from inflicting pain on a consenting adult. Masochism is pleasure from receiving pain from a consenting adult. Transvestic fetishism is receiving pleasure from dressing as the opposite sex. Exhibitionism is getting pleasure from exposing yourself to strangers. Oh my! Voyeurism is the arousal or gratification from watching unaware individuals undressing or having sex. The most common paraphilia of all is pedophilia, the arousal from prepubescent children.
While there is much debate over the causes of the different paraphilias, there are a few common risk factors that have been identified in multiple studies. Family dysfunction and childhood behavioral problems.
It's mine.
And childhood abuse, including neglect, emotional, physical, or sexual abuse. Can be a result of either suffering from or being witness to these forms of abuse or any sexual assault. Other possible risk factors include traumatic brain injury.
Nancy, I have a question.
Oh my gosh, Reanna. Ugh. With all those questions you asked in class.
Developmental delay, personality disorders, a lack of empathy for others, poor anger control, depression, anxiety, and substance abuse.
Ugh, I hate my life. Oh my gosh. Ugh. You pop these pills. Come on, let's go. Can't open it.
Paraphilias can also be associated with hypersexuality, poor sexual impulse control, and maladaptive social or sexual skills. Many of the theories behind the etiology of paraphilias are based on classic conditioning, also known as Pavlovian conditioning, in which an individual learns to associate inappropriate objects or behaviors with arousal.
Treatment of paraphilias involves pharmacologic therapy and psychotherapy. Pharmacologic therapy includes anti-androgen medications and gonadotropin-releasing hormone analogs to help decrease libido and reduce intensity and repetition of abnormal sexual behavior. Antidepressants are also used to help decrease aggression and treat impulses. Psychoanalytic therapy involves working with a therapist to help resolve childhood conflicts that may have contributed to the development of paraphilia. Behavior therapy is aimed at learning to discontinue abnormal sexual behaviors. Skills training and cognitive restructuring is used to help change the individual's thinking and behavior. Positive punishment is also used, such as providing shocks or bad odors, or associating anxiety-provoking scenarios with sexual impulses. A combination of pharmacologic therapy and psychotherapy has been shown to be most effective. Treatment is individualized to meet the needs of the patient.